Hi, Dr. Rodman here, and today we're going to talk about what to expect after a hairline advancement. Now, patients who are just having a hairline advancement are able to go home the same day. Patients who are having a hairline advancement as part of a larger set of procedures, such as facial feminization, will often stay one night in the hospital. Generally, the next day when patients wake up, they say that their scalp feels very tight and that they have a moderate headache. I do give pain medicine, but most patients say that just Tylenol is enough to help with the headache. Now, there's several layers of stitches that are at the incision. 3 layers of those are deep underneath the skin, and those dissolve on their own. There is a superficial layer of stitches that are in the skin, and those need to come out at about day 10 or 11. Usually the tightness and the headache resolves after 3 to 5 days, but patients should know that they will be numb on the top of their head for many months, even years afterwards. Now, this doesn't affect your daily life. It doesn't affect your ability to move your scalp or move your brows, but it will feel strange, almost like you have a cap on, and that feeling can last for several months. Like I said, it doesn't affect your daily life. It doesn't necessarily affect anything that you would do. But the thing people should be cautious about is that if you curl your hair or straighten your hair, you need to be able to watch yourself in a mirror because you may not be able to sense when you're getting too close, and it's possible to burn yourself because of your lack of sensation. Patients are able to shower after 48 hours, and I do recommend that patients go ahead and get in the shower and wash their hair in order to keep that incision clean. After the shower, I like patients to clean the area with hydrogen peroxide to remove any and all crusts, and then reapply a thick layer of ointment, either Vaseline or Aquaphor. Patients should apply scar gel and be very mindful to stay out of the sun for a full year after a hairline advancement. Taking care of the scar and what the patient does in those months and weeks after surgery is the most important factor in how well the scar heals. After surgery, patients may notice some increased hair loss. There's 2 types. One is hair loss right around the incision. There's also diffuse hair loss that can happen all over the head. Both are from shock loss, which is caused by a disruption in the blood supply, where more hairs will go into the sleeping phase and will tend to fall out more easily. Shock loss is temporary. Those follicles are still alive and intact, and that hair will grow back, but it may be several months after surgery before you see full restoration of the hairs that fell out immediately afterwards. Patients come back to the office day 10 or 11 to have their sutures removed, but scar care will continue for a full year. I generally recommend that patients put Vaseline or Aquaphor on the incision, and I mean coat it up completely gooey so that it's covered with a moisturizer for at least the first 2 to 3 weeks. After all of the scabs have come off and the skin is completely sealed, I recommend that patients switch to a scar gel. I like scar gels that are made with silicone and with sunscreen. That helps lock in the moisture and protect the scar from getting sunburn or sun exposure while it's still healing.